Assalamu alaikum. I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today, I am going to discuss about the hormonal contraceptives. Hormonal preparations are used for reversible suppression of the fertility. There are several types of hormonal contraceptives. First of all, oral preparations. There are three categories of drug that are included in the oral preparations. Number 1, combined pill. Number 2, progesterone only pill, and number 3, emergency contraceptive pill or post-coital pill. On the other hand, there are several types of other medications that are used for suppression of the fertility, that are transdermal patches, intravaginal agents, injectable agents, subcutaneous implant or Norplant, and IUCD or intrauterine contraceptive device. Levonorgestrel impregnated intrauterine device has contraceptive action for 3 to 5 years. It should be avoided in case of patient with PID or history of ectopic pregnancy. First of all, I am going to discuss about the progesterone only pill or mini pill. It includes levonorgestrel taken daily without interruption, and contraceptive effect is less reliable, does not interfere the lactation, so it is suitable for using during the lactating period. Post-coital pill or emergency pill, oral administration of high dose of levonorgestrel or high dose of estrogen with levonorgestrel. Within 72 hours of unprotected coitus, this post-coital pill should be administered and followed by further administration of this dose 12 hours later. The adverse effect of post-coital pill are nausea, vomiting, and nothing significant. Single dose of the mifepristone is also effective, has the luteolytic effect. Long-acting progesterone only contraception, that is injectable method, medroxyprogesterone is given. It is given through intramuscular route or subcutaneous route. It is very effective and safe. What are the adverse effects? Menstrual irregularities are very common adverse effect. Infertility may persist for many months after cessation of the treatment. Levonorgestrel implanted subcutaneously in non-biodegradable capsules, avoid. Bypass the liver, avoiding the hepatic fast pass metabolism, and tubes slowly release their progesterone content over the 5 years. What are the adverse effects? Irregular bleeding and mild headache are the adverse effect of implants. Contraceptive for male or male pill. Oral contraceptive for male are still in experimental stage. Now, the combined pill. It is composed of both estrogen and progesterone, and it is taken for 21 consecutive days out of 28 days, and rest of the 7 days patient should be taken iron tablets. Oral contraceptive pill, estrogen means the ethinyl estradiol or mestranol, and progesterone content second generation progesterone like norethisterone and levonorgestrel, and third generation progesterone like desogestrel and gestrodin, etc. Oral contraceptive pill defined as second and third generation pill by the progesterone component, and first generation progesterones are obsolete. Mechanism of action of oral contraceptive pill or combined oral contraceptive pill. Estrogen inhibit the release of follicular stimulating hormone and suppress the development of the ovarian follicle, and progesterone inhibit the release of the luteinizing hormone and prevent the ovulation, make the cervical mucus less suitable for passage of sperm, and together alter the endometrium in such a way to discourage the implantation. It also interferes with the coordinated contraction of the cervix, uterus, fallopian tube that is necessary for successful fertilization and implantation. What are the drawbacks of combined oral contraceptive pills? The mild adverse effects are nausea, mastalgia, edema, headache, withdrawal, bleeding, mood change. The moderate adverse effects are breakthrough bleeding, skin pigmentation, acne, weight gain, vaginal infection, and severe adverse effects are reversible hypertension, venous thromboembolic disorder, myocardial infarction, cerebrovascular disease, increased risk of breast cancer, cholecystic jaundice, cholelithiasis, cholangitis, depression, etc. The absolute contraindication of combined oral contraceptive pills are history of thromboembolic disorder, cardiovascular disease, cerebral ischemic attacks, hepatitis, cholestatic jaundice, migraine, carcinoma of the breast, SLE, undiagnosed vaginal bleeding. And the relative contraindications are family history of venous thromboembolic disorder or arteriolar disease, diabetes mellitus, hypertension, smoking, age more than 35 years, obesity, long term immobility, lactating mother, etc. Now, what are the non-contraceptive benefits of the combined oral contraceptive pills? Combined pill markedly decrease the incidence of ovarian cyst, ovarian and endometrial cancer, benign breast disease, iron deficiency anemia, lower incidence of ectopic pregnancy, rheumatoid arthritis, dysfunctional uterine bleeding, dysmenorrhea, endometriosis, amenorrhea, irregular period, intermenstrual bleeding, etc. Now, danazole. Danazole is the gonadotropin releasing hormone antagonist. Danazole is a modified progesterone which inhibits the gonadotropin production by an action on the hypothalamus and anterior pituitary. They constitute a new non-steroidal method of contraception and inhibit the output of the gonadotropins, affecting the mild cycle surge and inhibiting the steroid synthesis in the ovaries, decrease the sex hormone production. The indications of danazoles are contraception, hormone replacement therapy, irregular menstruation, endometriosis, dysfunctional uterine bleeding, dysmenorrhea, menorrhagia. What are the unwanted effects for danazole? The gastrointestinal disturbance is the common adverse effects, weight gain, fluid retention, dizziness, muscle cramp, headache and virilizing action in case of females are the important adverse effects of danazole. Thank you so much. That is all for today.